Hi everyone, welcome to WomenHeart's Roundtable discussion on women and heart disease and diagnostic testing. I am Dr. Martha Gulati, the Chief of Cardiology at University of Arizona in Phoenix. And I am joined today with two WomenHeart champions and patients that are going to today talk about their experience, both with diagnostic testing and how they were told they had heart disease. So I'm happy to welcome Evan McCabe and Star Colwell today. Ladies, do you want to start by talking about how your heart disease was diagnosed?
Sure, I'll start. What makes my story unique is that I'm a cardiology nurse, and so I knew I was having symptoms of chest pain. All my tests were coming back like I didn't have any heart disease, and I was just baffled. So I ended up needing to get specialized testing, and it just took a very long time. It was very stressful, and it was just a difficult time in my life.
What about you, Star?
Well, my heart story began 15 years ago when I had a massive heart attack following a complete cardiac workup, which I passed with flying colors. Since then, I've had multiple diagnostic tests, I've had bypass surgery, lots of heart catheterizations, and what I would like women to know is it's so important to have a relationship with your doctor, that you can trust your doctor and they can trust you. If you have a problem, you can go to your doctor and they will find out, they will run the test to find out what is wrong with you.
Well, so the interesting thing is that 66% of women ultimately get their diagnosis within 2 weeks, which that number probably sounds quite good. But what about the other women? That's the question I really have, because the other women might take up to 6 months, might take up to a couple of years. So do you guys have any thoughts about that?
Well, I can just say, with waiting for insurance companies to approve a specialist and waiting for, once you see the specialist, trying to get the insurance companies to approve the cardiac MRI that I needed, it just took so much time. And your anxiety level is increasing more and more as that goes along. So what I would recommend is really be patient. What I really found helpful was learning more about the diagnostic test that I was going to get. I think knowledge is power, and learning more about it is really important.
I think that we know from national data as well as our own survey that this is a common feature. Women might even be more symptomatic and still not get the testing that they need. And it takes a longer time for them to get a diagnosis. Sometimes they're not even placed on the right medication. They undergo procedures again and again, trying to get the answers for what's going on with them. Did you experience any of that, Star?
I did just recently, I was having heavy legs, and I kept telling my primary care doctor I have this heavy leg feeling, and he said it was my back. Finally, I had had enough, and I had trust in my doctor had trust in me. I called her up and I said, I think I need a heart catheterization. And they did the heart catheterization, and they found out that I had 80% blockages in both my legs. So sometimes you just have to push, and you know your body, and you have to have trust in your doctor to trust you.
Is there any advice you'd give to other women so that they can advocate for themselves?
What I would recommend is definitely when you go to have a diagnostic test is to bring a family member along with you, because very often, and I recommend having sedation if you're very anxious when you do have the diagnostic test, but very often the doctor will speak with you right after that test. So if you're sedated, you often don't remember those things, and it's nice to have an extra set of ears.
Star?
I agree with all of that, and I also think that you have to not fear testing. If a doctor orders the test, don't be afraid to have it, because it's knowledge. They're not always accurate, these tests, but they give you knowledge, and that knowledge can save your life sometimes. So, don't be afraid of a heart catheterization. Don't be afraid of a Doppler test.
I think that's all really important. I think that for women, they need to know that tests aren't perfect, but they do help us as physicians decide on what are the other tests that we need. So thank you again for joining us today for our roundtable discussion. I hope that you can use this information either for yourself or for loved ones. And here at WomenHeart, that's what we want. We want women to understand their hearts. So thank you for joining us.